Is there anything we can do about the fact that 20% of people who give birth are going to end up with a levator ani avulsion, and that goes up to 50% if you have a forceps delivery? This is a great question, and it leads me to one of my very favorite articles. This article is from 2024 by Delancey, who's one of the really big names in pelvic health. And I love this article because it really goes into all of the things that can sort of go wrong during childbirth and the ways that we can maybe potentially prevent them based on what research we have. It's a really great example of the sort of roundup of research that we have done in this space, because I know so many people are so frustrated by the lack of research, and there is a lack of research, but this is a great way to see all of the research that we do have. In the abstract, it talks through some of the risk factors, including forceps delivery, occiput posterior birth, older maternal age, longer second stage of labor, and birth weight more than 4,000 grams. So then it goes and talks about some of the potential prevention measures that we could take, and talks about some specific strategies that could potentially reduce, such as avoiding forceps delivery, manually rotating the baby, perineal massage, early induction when needed, slow gradual delivery, and some potential ones like pre-dilating the tissues, and risk assessment for seeing who would benefit from a cesarean section. He also brings up pushing against a tense pelvic floor, so when the levator muscle is contracted and we're trying to push against it, that could potentially put people at a higher risk. He also strongly recommends pelvic floor muscle training as a way to help prevent perineal trauma and as a way to help treat issues afterwards. Not that we're fixing the avulsion, but that we can help strengthen the muscles, support for pelvic organ prolapse, help with symptoms, etc. And in my last video, I talked a lot about the fact that most of these injuries don't get diagnosed early postpartum because it's tricky to diagnose and because we don't really have a lot of great treatments for it yet. But I love how Delancey here flips the script and talks about how early recognition should be important, and I absolutely agree with that. And we need to educate women on the risks. It's only right that women be made aware of these risks during pregnancy. Not everybody wants to know about issues like this during pregnancy, and that's absolutely fine, but people should be able to make informed decisions about their care, and they should have the option to be informed if they want to be.